Hearing loss is often thought of as something that only happens in old age. But the truth is, we're all exposed to potential hearing damage every day, sometimes without even realizing it. The things we do, the environments we're in, and even the products we use can all have an impact on our hearing. While the damage might not be immediate, it builds up over time. And before you know it, you're struggling to hear the world around you. So, what's really harming our hearing, and how can we protect it? Let's dive into some of the most common causes of hearing damage that might surprise you. 1. Loud music and headphones. First up, loud music and headphones. We all love to listen to music, but when the volume is cranked up too high, your ears are absorbing a lot more than just the beat. Using headphones or earbuds at high volumes is one of the biggest culprits when it comes to hearing damage. Imagine your ears as sponges. If you keep soaking them in loud noise, they'll eventually become brittle and worn out. The tiny hair cells inside your inner ear, responsible for picking up sound, can become damaged with prolonged exposure to loud sounds, and unfortunately, they don't grow back. You may not notice the harm right away, but the more often you listen to music at high volumes, the more damage your hearing takes. Once those hair cells are gone, they're gone for good, leading to permanent hearing loss. Tip: stick to the 60/60th rule. Listen at 60% of your device's maximum volume for no more than 60 minutes at a time. You can also invest in noise-canceling headphones, which allow you to enjoy music at lower volumes while still blocking out external noise. 2. Noise pollution in the environment. Next, let's talk about noise pollution. We're surrounded by noise traffic, construction sites, crowded places, and even constant machinery sounds. If you work in a loud environment like construction or a factory, or if you live near a busy street, your ears are constantly exposed to sounds that can be harmful. Prolonged exposure to noise levels above 85 decibels, like motorcycles, sirens, or lawnmowers, can gradually damage your hearing. Imagine trying to sleep in a room where someone is playing a loud drum set all night. Over time, you'd get tired of it, but your ears might start to lose their ability to filter out the noise, making it harder to focus on the sounds you actually want to hear. That's what happens when your ears are exposed to constant loud noises without proper protection. Tip: if you're in a loud environment, wear earplugs or noise-canceling earmuffs. If you can, take regular breaks in a quieter space to give your ears a rest. 3. Ear infections and hygiene practices. Let's shift gears and talk about ear infections and hygiene. You might not think much about ear health, but ear infections can lead to serious hearing issues, especially if they're left untreated. If you have frequent ear infections, or if you constantly dealing with fluid buildup in your ears, it can damage your hearing over time. Even improper cleaning of your ears using cotton swabs to dig deep into your ear canal can cause harm. When you push wax deeper into the ear, it can lead to impacted earwax, which can cause a temporary loss of hearing. Plus, ear infections, especially in younger children, can lead to long-term damage if not treated properly. Tip: don't insert anything into your ear canal. Your ears are self-cleaning. Clean the outer part of your ear with a damp cloth and avoid cotton swabs. If you're dealing with frequent ear infections, it's important to see a doctor to avoid long-term damage. 4. Aging and genetics. Now let's talk about aging and genetics. Hearing loss is a natural part of aging. As we get older, the hair cells in our inner ear naturally break down and don't regenerate, leading to gradual hearing loss. This condition is called presbycusis, and it affects many older adults. However, what many people don't realize is that genetic factors can play a huge role in determining when you start experiencing hearing loss. If your parents or grandparents experienced hearing loss as they aged, you might be at an increased risk, even if you take all the right precautions. The good news is that while you can't control your genetics, you can protect your hearing by being proactive about avoiding other damaging factors like loud noise and untreated ear infections. Tip: as you age, get regular hearing tests to monitor any changes and seek treatment early if needed. 5. Medications and ototoxic drugs. Certain medications can also damage your hearing. These are known as ototoxic drugs. Some antibiotics, chemotherapy drugs, pain relievers like high doses of aspirin, and even diuretics can cause temporary or permanent hearing loss. It's like taking medicine to fix one problem only to cause another. These drugs can affect the delicate parts of the ear and lead to hearing issues over time. Tip: if you're prescribed any medication, ask your doctor about its potential impact on your hearing and explore alternatives if necessary. Always follow the prescribed dosage and never exceed the recommended limits. 6. Smoking and secondhand smoke. Here's one you might not expect smoking.
Smoking doesn't just harm your lungs. It's also bad for your hearing.
The chemicals in cigarette smoke can reduce blood flow to the inner ear, leading to nerve damage and hearing loss.
If you're exposed to secondhand smoke, you're also at risk. It's like constantly depriving your ears of the nutrients they need to stay healthy. Tip: if you smoke, quitting can have numerous health benefits, including protecting your hearing.
If you're around smokers, try to limit your exposure to secondhand smoke as much as possible. So, what's the takeaway here?
Hearing loss doesn't just happen when we get old. It starts with the little things we do every day. Whether it's turning up the music too loud, not protecting our ears from environmental noise, or neglecting ear infections, we're all at risk. But the good news is we have control. By making simple changes like lowering the volume, wearing ear protection, and taking better care of our ears, we can protect our hearing for years to come. If you found this video helpful, be sure to like, share, and subscribe for more health tips. What's one change you'll make today to protect your hearing? Drop a comment below. I'd love to hear your thoughts.